Hi, my name is Vivian Nightingale. I'm in 12th grade and I intern at Kaiser Orthodontics. My career goal currently is to become a nurse and then go to dental school. Kaiser Orthodontics has provided me with an opportunity to fully know that I do want to go to dental school. Before interning for them, I only thought I wanted to be a nurse and become a dermatologist or a nurse practitioner injector. But with the help of Kaiser Orthodontics, I realized that I don't want to become a nurse forever. I want to become a dental assistant or an orthodontics assistant, but yeah. So a short little description of my role at Kaiser. I assist with whatever they need that day. It depends on the day, but some of the things I do are I stock inventory of different colored braces. I take patients to their chair and do patient assisting, chairside assisting, writing down notes for Dr. Kaiser, putting them into the computer system. Sometimes it's even just talking with patients about treatment plans or just decorating the office for holidays or just cleaning up around. So some basic skills I have realized you need for this sort of internship is to be comfortable with public speaking. That is something I did not know I was going to need, and I use it daily. You're talking with patients who you don't know, people who you've never met. They can be scared, nervous, excited. You need to know how to approach a situation professionally and confidently, and that is something most people don't know until they have to do it. And so that's what I would tell an incoming intern, like, are you comfortable with speaking to someone who you don't know? And you just need to have a positive attitude about everything. Look on the bright side. Orthodontics is something that is forever. You will always have your smile, and we want to help improve that and improve the way you want to look, and that is something you need to have. So at Broughton, I have taken anatomy and physiology, biology and chemistry, and earth science. And the one that I feel that has helped me the most is definitely anatomy and physiology. I'm taking it currently as a senior, and even within the first week of internship, I could already tell that anatomy had already helped me. Dr. K, speaking of distal and medial and just different ways of growth of the jaw, I could tell that I had already learned some of those terminology and vocabulary through anatomy and physiology. Now, biology has also helped with the DNA side of orthodontics and dental care, to see why someone has an overbite or an overjet. You can correlate that with DNA, and I wouldn't have known how to do that without taking biology first. So overall, anatomy has helped me the most, but secondhand, biology. I would 100% say seeing the confident smiles come out of Dr. K's office is the most rewarding thing in this field. I absolutely love it. Again, I thought I wanted to be a nurse practitioner or a nurse injector because I wanted people to feel confident. I feel like that's something you need. You need to be confident in your life, and that's fun. And I thought giving Botox or filler would make me fulfilled in that sort of sense, until I came to Dr. K and I realized that smiling is something that brings so much confidence to someone, and it is so rewarding to see someone come out of treatment so confident in themselves and ready to take on the day with a brand new smile. That is the most rewarding feeling ever, especially for Dr. K, knowing that she made this happen. It is just so fun and exciting to see it in the real world. they're so excited and they're so happy that they have a new smile and they're confident, and it just fills you with joy to see other people confident in your work. It's amazing. The most challenging part of internship has definitely been not having the actual schooling that Dr. K has or the assistants have. So it's been challenging to learn what they mean by a gold football as a drill bit or things in the lab. I'm learning that currently with them, but it is definitely hard to be fast on your feet when they're asking you to grab something for them. I'll have to ask a couple of times, but they completely understand, and it's okay because, I don't have that schooling, and they know that. But it's definitely challenging to be quick with what they're asking without knowing where it is or what it is, if that makes sense. Okay, personal skills or personal characteristics you need would definitely be just confidence and able to talk to many people. People pleaser, I can talk to anyone. And I feel like that is something that you absolutely need to have to be in this sort of field. You don't know who you're talking to. They could be a Medicaid patient, and this could be a big expense for them. This could be someone who has flown out of the country to you for your personal treatment. This could be a boarding student who has no parent with them. You need to be able to approach every situation differently in a respectful manner, but in a timely manner, and able to just communicate properly what pros and cons are, and you just need to be able to speak confidently to your patient. Again, with the timely manner, you need to be able to stay on top of your tasks, do everything you need to do, ask questions when you need, but in a timely manner. We usually like to get patients in and out in less than 30 minutes, unless they're doing a debond, which is taking off the brackets. That will take about an hour. Again, with the patient sitting in the waiting room, we do not want patients sitting in the waiting room more than 15 minutes, and we actually pride ourselves on never having someone in the waiting room for 15 minutes. But you definitely need to be a good communicator, public speaker, and time manager. Some job-related skills I have learned is a lot about HIPAA. Everything with a name on it we have to cross out. I've learned how to input patients' inventory into the computer system. I've learned how to restock and order new items for our office. I have learned how to make public relations with other companies. I've gone to lunch meetings with other offices and brand ambassadors like Lightforce. Within my first week of internship, I was at a lunch meeting to celebrate our 100th case with Lightforce, which is clear brackets. I've learned how to create relations with other companies, which is something big in this industry, and get our name out there. I have made gift boxes and delivered them to other offices, dental offices, jaw surgeons. What advice I would give someone joining this internship program? I would say go for it. You are going to have a not so easy time finding an internship if you don't put your full self out there and go full force. I went and interviewed with about 7 different companies until I found Kaiser, and I felt completely at home. You need to feel confident that you are supposed to be there. You are an employee, you are an intern, you're not an imposter there. You need to feel confident that this is what you want to do. You want to put your best self forward and go for it. You're never going to get another opportunity like this, and it is truly so rewarding, and you need to go 100% in whatever your supervisor asks you in your journals, in your photos, everything you need to go 100% and put your best self out there, because it is rewarding and you learn so much. So how I manage my time and responsibilities with internship and outside of internship is at the beginning of the month, I email Dr. Kaiser and the admin team my hours and what days I'm going to be there. I set it out for the month so there can be no changes. If something happens, like I get sick or a doctor's appointment comes up, it's okay, and it's reasonable to not be there the full time. She understands completely that I have a job outside of internship. I work outside of internship. I dance. I have school. She understands. But the way I can stay on top of my hours and be there as much as I can is I set it out for the month. So at least every 2 days a week, I go in for at least 4 hours. 3 to 4 hours usually per day. So that averages out to about 8 hours a week, which allows me to stay on top of my hours, but also gives me a little bit of wiggle room just in case I have something that comes up towards March and I need to skip a few days of internship. She completely understands, and I'm still able to complete all of my tasks and responsibilities within internship due to the sole reason that I set it out at the beginning of the month for everyone. So everyone knows when I'll be in and when I'll be out, and there's no confusion. I say I have the best supervisor ever. Dr. K is amazing. She's so sweet and nice to me, and all of the staff are just so wonderful. They help me with whatever I need. They're so involved in my life. They want to know where I'm going to college. They tell me all of their experiences, and they want me to be hands-on with them. They want me to come look at what's happening in the lab. They will call me over and show me how to do something new when they find it interesting. They are so supportive. They want me to learn, and they want me to succeed, and they are willing to do anything I need or ask or have questions about. They will stop whatever and answer them, and I'm so grateful for the staff and Dr. K. They are amazing, and I would not be where I am in the internship program without them helping me.